Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Molly Mraz, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters. It's the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topic for Public Health Matters is men's health. And on average, men's life expectancy is about 5 years shorter than women's. And we will be talking about men's health in order to heighten awareness of preventable health problems. Joining us today is our Harford County Health Officer, Dr. David Bishai, and Internal Medicine Specialist, Dr. Philip Halstead. Welcome to our show, and thank you so much for being here today.
Pleasure.
Yes, we are excited to have you, and it's so nice to meet you, Dr. Halstead, and we can't wait to start the show and learn about men's health. So do you want to tell us a little bit about yourself and how we came to be at this table?
Sure. Well, first of all, thank you for allowing me to be on the show, Molly, to speak about this very important topic. My name is Dr. Philip Halstead. I'm an internal medicine specialist, actually integrative medicine, because I've combined regular internal medicine with natural medicine throughout my career for 31 years. And I decided to make a switch about 2 years ago to holistic health coaching, which helps to have people become more centered, become the centerpiece of their own health care, and to be able to take control of their health. So that's really where I am now, and I teach at 2 different health coaching schools, also teaching people how to do this, and I'm just honored to be here.
Great, thank you very much. And Dr. Bishai?
Yeah, so I'm the health officer of Harford County, and I've been with the health department for about 6 months now, and working with all of the other members of county government to try to make Harford County citizens as healthy as possible. And that definitely includes men, because as you say, they're behind women by about 5 years, and so we've thought of many different ways to share about how men can close the gap and really live healthier and fuller lives.
Why would you say it's important, Dr. Halstead, we'll start with you. Why do you say it's important to really talk about men's health right now?
Because I think it's one of the topics that really has been swept under the rug for a long time. And I think part of that is cultural, because I think men in general, just culturally, we like to be strong. We like to be the oak. And we don't like to really show our weaknesses or any problems that we're having. And we kind of think of it as a faultiness if we really kind of talk about our health or health problems. But I think it's really imperative that we really tell people and get men to know in particular that it's okay not to be okay. It's okay to, if you have health issues, to get them checked and get them worked on. So things like this, this meeting we're having here today, just to try to shed light on what men can do and what they should do in order to improve their health, I think is very, very important.
Do you think it's generational, like, you know, our parents and grandparents maybe were less likely to go to the doctor because they needed to be strong and it wasn't really something that was taught to them, but now that the dynamics kind of shifting, do you think that maybe our younger generation would be more likely to go to the doctor?
I would hope so, but I think that's changing maybe slowly, maybe too slow. And I think we need to do things that can really help to speed up that transition where men really get more in tune with the fact that they, in order for them to be all that they need to be for their families, they need to be healthy. And to be healthy, they need to make sure that they're following up with their health, doing daily health practices that are going to keep them strong and vibrant and be able to help take care of their families. So I think if we kind of approach it from that viewpoint, I think we can kind of get men to kind of understand how important it is for them to maintain their health.
And we talk about health, you know, many people might be thinking just physical health, but mental health also. And I have a statistic here that suicide rates are 3 times higher in men compared to women. And what is believed to be the cause of this?
Well, it's actually kind of interesting with that statement there. Yes, men do commit suicide more often than women, but in actuality, women actually have more suicide attempts than men do. The difference is that men, women, when they try to commit suicide, they might more likely to use pills or less violent means of committing suicide, whereas men what they'll do is they'll use more violent means to commit suicide, such as gunshot, hanging themselves, things like that. So in actuality, the number of suicide attempts is higher in women, but the number of successful suicides is higher in men. So the overall effect of that is that men have a higher suicide rate.
What I see in the ER often is the suicide attempt is often just a cry for help and an attempt to try to get relief from the despair. And men are, as you say, less likely to just cry for help, but so deeply in despair that they'll use a lethal means, and there's no coming back. And despair and disconnection is the fundamental reason there is a suicidal ideation to begin with. To wish to be dead really requires nothing to live for and a lack of connection. And I think a lot of men might find themselves in those positions in today's world, where they've reached the end of their rope, things haven't worked out, they're isolated from their families, they've tried to create a family that didn't work out, and they'll end up alone. And when we know of men like that around us in our communities, in our church groups or workplaces, it's really important to identify those men and give them a lifeline and get them back and connected to society.
And by the time that they've come to the ER, maybe with a suicide attempt, it's kind of like that those warning signs are overdue, right? They're
Sure.
kind of,
well, if it is a cry for help,
Right.
It's up to all of us to get the help and to make sure they're plugged in, to keep followed up. And believe me, in the ER, we do everything we can to plug them into care at that point. I don't want to over-medicalize it, because really it's the environment that they live in, and they'll only see a healthcare professional maybe a few times a week at most. It's the environment. It's what is going on in their search for meaning and purpose and connection. I think that's what all of us are striving for. And Harford County really is a place where everybody can find that, and it's up to all of us to supply that.
what are some signs, just some signs to look for, especially in men, that would indicate that they may be suicidal?
Well, you look for symptoms certainly of depression, certain mood changes, not having that same kind of desire to do things or finding pleasure in things that they used to find pleasure in. Definitely substance abuse, alcohol abuse, if those things start to rise up or start to become more common in those individuals. Certainly excessive fatigue, changes in their diet or changing in how much they eat, because sometimes with mental illness, sometimes people will eat more than they usually do, or sometimes they'll eat less than they normally do. So there's a change there. Also, sexual behavior. Sometimes people with mental illness become more risk takers in those areas as well. So also paranoia, increased violent behavior. These are sorts of things that really should really kind of get you thinking, like, is something going on with this individual? And in particular, especially with depressive type symptoms, it's important to have a timeline with that, because everybody gets down at times. It's very common. It's not uncommon or not abnormal to be down for a day or two, and then you perk yourself back up and you get back on with life. With depression is when those symptoms last for 2 weeks or more. Then that's when you start really wondering whether or not this person is actually suffering from a mental illness such as depression, and that may definitely need to be looked at closer. So, yeah.
And how, what can we do to address men's mental health, to really bring awareness to mental health and hope that we can reduce those numbers?
Well, I think that both listeners and viewers of this show should really pay attention to what Dr. Halstead was saying. Am I having trouble sleeping and eating? Am I losing weight? Am I acting out? Am I becoming more inclined to lash out at people? And so if you see those symptoms in yourself or in a loved one, really get help. And I know that there's so many resources here. We've got hotlines and websites, and it's pretty easy to get help. And it's just like an obligation that you have to yourself. It is so terrible to be in this state, and a lot of people lose hope and they think, well, it won't get any better, it can't get any better, but it does. And reaching out for help is the first easy step to get better. We have treatments that work. We have supportive counselors that are there to help. I know you find that people feel they put it off, they think that the system won't be there for them. And how do you overcome that?
Well, I think one thing you mentioned there was, especially in the time of COVID, is websites, and there are different apps that people can access. And actually on those apps and websites, they have actually surveys that people can take to kind of determine whether or not they're suffering from some sort of a mental illness like depression. And sometimes those apps and websites are very useful because, for one reason, people can kind of do them privately, because sometimes people are afraid of the stigma, so they don't really necessarily want to go see somebody for it. But if they can kind of do those surveys and get information privately, then that can kind of give them an idea of what's going on, and then they may be more inclined to kind of go ahead and seek help. And I think they've done studies that show that people who get on those sites and do the surveys are actually more inclined to seek help, because that way they kind of get that first inkling that there's an issue, and they have something in black and white, something that's on paper that's showing them that their symptoms really are dangerous. And sometimes that can help them to kind of drive them more towards getting help.
And you mentioned COVID and just kind of how, mental health has affected COVID has affected so many people's mental health over the past, year plus, and it's just been a really trying time. So really trying to reach out, recognizing any kind of sign in your loved one's life, and just trying to advocate for them if they can't advocate for themselves.
Yeah, it's
right?
important for everyone to know what the signs and symptoms are. Like you said, it's important for people who may be suffering from those signs, but also for their family members, the people around them also.
Right.
Because sometimes the individual might not actually see those changes in themselves,
Right.
but their family members can actually kind of objectively see those changes, and
Yeah.
that can lead to a better outcome, or having them seek help.
What about heart disease? That suicide was a very heavy topic to kind of introduce this topic, but heart disease is a leading cause of death for men and accounts for a quarter of men's deaths. So let's talk about heart disease, how they can avoid it, and kind of what qualifies as heart disease. I guess, Dr. Beshai, we'll start with you.
Sure. So I'm glad you brought it up, because it is the #1 cause of death in America and cause of death in men. Heart disease comes from blockages in the coronary arteries, most likely due to both diet and exercise. And the way to prevent it is eating a healthy diet and taking regular exercise. This needs to be started. The best day to start exercising if you don't exercise is today. It's not as though there's ever an age where you're too old to get started. Ideally, you would have started early in life just to get into the habit. It doesn't have to be, running a marathon. Seriously, walking as short as 20 minutes a day is enough to give yourself cardiac benefit. And those habits are good. Now, if walking isn't your thing and you want to take up any other type of activity, just get off the couch and get moving. The sooner the better. And in terms of diet, I mean, these days everybody kind of knows that we do need to include fresh fruits and vegetables, and to get 5 fresh fruits and vegetables every day. If you do that, that's a good start. And then avoiding saturated fats, that means red meat and animal-based fats that come in the form of butter and eggs. We're not saying none of it. We're saying to use it in moderation and to limit your intake of those saturated fatty foods, and to really focus on plant-based food on a regular basis. Those plant-based foods help prevent cancer as well, but because you're eating so many plants, you're not going to have the types of foods that will make you gain weight and build the plaques on the arteries that feed the heart.
And just knowing what the risk factors for heart disease are: hypertension, high cholesterol, smoking, being able to monitor blood pressure, make sure it gets treated if it needs to, make sure your cholesterol is checked, treat that if it's need be, and quitting smoking if you're smoking. So just kind of knowing what those risk factors are and knowing how to approach them and how to treat them or avoid them or eliminate them is going to be really important to lowering risk of heart
Yeah,
disease.
I'm glad you brought that up because these are things that everybody can do right now. Blood pressure measuring is so important, and I'm so furious that insurance companies don't always cover blood pressure cuffs. I think every family probably has somebody with high blood pressure in it. I think every household needs to have a blood pressure cuff. And everybody over 50 should know their blood pressure. You're not saying measure it every day, but you need to know your blood pressure. And it's something you should get used to doing in your house. It is so important to know, and it's such a treatable risk factor for heart disease. And the treatment is often, it doesn't have to be pills. A lot of people with high blood pressure can manage it without pills. They just need to know what it is and keep getting that reading regularly. I think if you are in a house that doesn't have a blood pressure cuff and a birthday or holiday is coming, it's a perfect Father's Day gift.
Right.
It's not too late. Hey, Dad, I know it's late, but I'll get you this Father's Day gift. Here's your blood pressure cuff. It is such an act of love.
What a fun present. The main message, though, for all of it, you have to kind of go to the doctor to even know that you have hypertension, that you have high cholesterol, right? So just encouraging, how do we encourage men to go to the doctor? Even if, so say they're not even symptomatic from anything. Like there's really no need for them, that they think, to go to the doctor. How do we kind of like assist them in getting there?
Well, as a woman, Molly, you know what it's like, and living with a man, showing how much you love them is by asking them to get care. But men themselves, let's be honest to the men who are watching this, they change the oil in their car. They maintain their tools, they maintain all of their equipment that's necessary to do their job. And your body is your biggest tool in life. So just as though you would maintain your vehicle's automotive system working and you check your oil and clean your air filters, you got to do this for your body. Certainly after age 50, there's a lot to gain with a well patient checkup. And certainly checking in even earlier than that is fine. After 50, there's a lot a visit to a doctor can do to keep you out of trouble and keep your tool running very well.
Some of that is, cancer screenings or just kind of being aware of the possibility of having cancer. And so there are certain types of cancers that affect males, if you would like to go into that.
Well, certainly men are obviously more prone to testicular cancer, prostate cancer, lung cancer, colorectal cancer. I think those are kind of the four main ones. Obviously, all cancers need to be watched and monitored, but I think those are kind of like the four big ones. And they're very much related to regular health habits and how well or how unwell men maintain their health, with their proper diet, exercise, regular checkups and screenings, because as you said before, many things don't have symptoms. There are definitely conditions like high blood pressure, for one, doesn't have symptoms, okay? And certain types of cancers will grow to a certain point and then have symptoms, so they can actually be there for a while. So that's why screenings are so important, because you can actually detect things before they become symptomatic. Self-testicular exams in men over age 40, 45, I would say start that. Making sure they're getting their prostates checked. African-American men, I start them at age 40. I mean, I don't think it's too early. I don't think
it's not. For testicular, I would start boys, even after puberty. The young, in fact, in younger men, testicular cancer is your number one cancer between ages 15 and 40. That's so I think if you have a son, just say it's okay to be checking your scrotum on a regular basis for anything unusual, because it's so treatable, and it's a pity to find testicular cancer in a later stage. Even then, it can be treated, but the outcomes are super high survival with early stage testicular cancer.
Precisely. It just boils down to awareness and just screening and just doing exams on a regular basis to prevent these things.
Are there any other diseases that are more prevalent in men than women?
Injuries.
Injuries?
Both unintentional and intentional injuries, are more common in men than women. Some of it is occupational, but automotive injuries are a leading cause of unintentional injury in younger men. Intentional injuries, violence, often triggered by alcohol use, is often a way that a man is going to develop an unintentional injury and start a fight or start a feud. Certainly there might be reasons to act out in this way. Certainly gun ownership is more common in males, and so we do know that men's death rates will start to go up in their late teens, early 20s as a function of both being exposed to more risk-taking behavior in their occupations and in their driving behavior. And that does take a toll. And again, COVID, let's be honest, COVID-19 is killing more men than women, and COVID vaccination rates are lower in men than women. And I know we're talking about things that might seem hard, like losing 20 pounds or giving up tobacco, but getting a shot for COVID, if you haven't gotten the shot yet and you're a man, this is like the simplest #1 thing to do to improve your life. COVID was the 3rd leading cause of death in the county last year. And if you're unvaccinated, given what might happen in the next 6 months, it could still come back and get you as an unvaccinated person, whereas the rest of the vaccinated community can really take a breather and just not have to worry so much about getting COVID. So for men's health, I would say simplest, easiest thing to do. They're all over the county. Walk into any Giant or local pharmacy. There you go. You got your COVID shot.
Yeah.
And other things too with men, particularly like things like lung disease, it's very common. Alcoholism and what it can lead to, like liver disease, very common as well. Different problems like HIV/AIDS is another one, especially in minority populations or even where there's high IV drug abuse. That's always a major risk as well. So, and we've already mentioned heart disease and cancer; those definitely are there too.
And then with the minority groups, with HIV, are there any other diseases that would affect them more than?
Well, heart disease, coronary artery disease, definitely. Colorectal cancer, definitely, because it's so highly diet related.
Right.
High fat, high sodium, high sugar diets really lend themselves to development of heart disease and colorectal cancer. That combined obviously with men not following up with their doctors, not getting their stool guaiacs done, check for blood, all these things really play into it. So yeah, so those are going to be the main ones, and lung disease too from heavy smoking as well.
How does a family history kind of impact your outcome for disease?
It's so important for people to know their family history if they can. I mean, for heart disease especially, if I know that somebody has a first-degree relative, that meaning father, mother, brother, sister, that has had heart disease, it changes everything in my mind. It is as big a risk factor in my mind as smoking and obesity or high cholesterol. So there is a strong genetic component to heart disease and cancer as well. There are some cancers that are genetic. And families talk about it, and it also influences your awareness. So I don't know how many people will come in with a heightened awareness of any chest pain if their brother has had a heart disease. So the system sometimes works, but it also works opposite. It is, oh my God, this took my brother. I'm going to hide my head in the sand and ignore it, and if I ignore it, it's going to go away. Well, it won't go away.
Right.
You got to be smart, and there's nothing special about us. If it's in our families, it's probably going to be a problem for us, and it doesn't have to take us down. There's something you can do to fight back. Thank goodness we live in a world where we do have effective treatments for these conditions. It's not like it was 500 years ago where the whole family's going to get wiped out.
Yeah, I think it's important too with family history to realize too that family history is basically determined primarily genetically, but it's also determined environmentally as well. Because people who eat, you know, if parents eat a bad diet and have heart disease, the children probably going to eat like the parents do. So, but family history really should be, in my mind, kind of used as a guide, not so much to scare people into thinking that they're going to get those diseases, because your genes don't necessarily have to be expressed. You can be carrying genes for certain diseases, but if you really take care of yourself in a proper way, those genes don't necessarily have to be expressed. So I think family history is important to know, but it's also important to be as a guide to further educate you about what healthy things to do in order to head off those genes so those genes don't get expressed, and that you can break the chain. If you know, every 5 generations before you had heart disease, and you know it's there prevalent, then you know that you should start eating a low, high plant-based diet, high nutrient-dense diet, exercising, and then maybe those genes won't be expressed in you. And then that way you can break the chain for your kids and future generations coming up behind you.
Right.
So.
And even so, maybe all of those things to do at one time are kind of overwhelming. If there was one thing that you wanted for men to start, would it be starting with a healthier diet? Would it be exercise? Would it be quitting smoking? What would be like your one, we'll start with you, what would be like your one thing? With
me, based on my background and what I believe health to be based on, I would start with the diet first, because I think that healthy cells make healthy tissues make healthy organs. So the building block, the foundation is going to be, and what you become is going to be what you feed yourself and what you absorb into your body. So for me, it starts with diet, okay? Getting the salt, the sugar, the fat out of the diet, getting healthier, more nutrient-dense, plant-based type foods into your diet on a regular basis, drinking plenty of water, at least half your body weight in ounces every day, and then coupling that with exercise. I think that's really going to be what's going to kind of kickstart things physiologically for people to start feeling better.
What about you, Dr. Beshai?
Well, I would echo that. I certainly do think that diet's important, but my own experience with diet, it's really hard for me to make any commitment to behavioral change except when I socialize it. When I tell other people that are mattering to me, my family, my partner, my kids, that I am going to make a change, that puts my skin in the game. It makes me accountable. And I think that men should socialize their decisions for better health and with their partners and families. That way any change kind of gets that accountability. So that'll keep you accountable for your diet. And putting your partner in the mix is I think helpful for both ways, because you can hold each other accountable and you could do things together that way. We find that when families do make their behavioral changes together, it's more sustainable and more fun to be doing it all together.
Right, you kind of have that team spirit going on.
Yeah.
And we want men to go to the doctor. We care about them. We're running out of time, so I'm just trying to, our final messages here is like, we care about you. We want you to go to the doctor. We want you to be around. We don't want to miss 5 years of life with you, right?
That's right. It's really, the family is one of the best tools for better health.
Yeah. Well, thank you so much for being on the show. That flew by, and I'm sure we have so much more to talk about too, but maybe we could do a follow-up. That is all the time for the show we have today. I would like to thank my guests on today's show, Dr. David Beshai and Dr. Philip Halstead. If you have any more questions, you would like more information on men's health, please refer to the resource page after this program. And please join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.
You've been watching Public Health Matters, brought to you as a public service by Harford Cable Network, your county connection.